All right. Hello, everyone. Thank you so much for joining our Genetics Policy Hub webinar. It's 2:01 on the East Coast. And we'll just give it one more quick minute to let anyone else from the waiting room in, and then we can get started. All right, so I think we can get started. So again, thank you everyone for joining our Genetics Policy Hub webinar. Just a couple of housekeeping things. So everyone will be muted as we go through our presentation, but feel free to please chat us any questions or thoughts you might have along the way so we don't miss them. Because we will have a question and answer session at the end of the presentation. So we can go on to the next slide. Perfect, thank you. So I'm really excited to be sharing this Genetics Policy Hub webinar on the topic of genetics privacy with you all today. So my name is Molly Case, and I am the project coordinator for the National Coordinating Center for the Regional Genetics Networks. We're really thrilled to be co-presenting this webinar with our partners from the New England Regional Genetics Network, NERGN's project manager, Ms. Karen Vole, and NERGN's project director, Dr. Angela Shepard. And this project is supported by the Health Resources and Services Administration, and we're also very thankful for their support. I'll go on to the next slide. Great. So this webinar is being held as part of Public Health Genetics and Genomics Week. So this week is an awareness campaign that seeks to raise awareness and to really celebrate the field of public health genetics and genomics. Public health genetics and genomics applies genetic genomic information to improve public health and prevent disease. So to achieve this aim, it takes many different types of organizations and individuals to apply genetic concepts to public health. And in overlaying those individual activities and programs is policy. Policy really affects every level of public health genetics and genomics, which is why we're so excited to offer this webinar in celebration of the week. We really hope today to demonstrate one part of the policy discussion of public health genetics and genomics in this webinar, which is policy education and discussion. But if you would like to learn more about other areas of policy that affect public health genetics and genomics, or to learn more about the week in general, all the events and activities that we've held during this week are available on the Public Health Genetics and Genomics website, phgw.org. There are resources for healthcare providers, patients, families, public health professionals, advocates, nonprofits. So if you weren't able to attend an event this week, or if you just want to learn more, you can view recordings of all this week's events. There's great resources there. And we're also looking forward to hosting new events during Public Health Genetics and Genomics Week in 2024. And we hope you'll join us then. On to the next slide. Thank you. So on this webinar today, our objective really is to provide context about what genetics privacy is and why genetics privacy is a policy concern. So we'll share what current policies exist at the state and federal level related to genetics privacy, and really what the implications of these policies are or might be. And by the end of the presentation, we hope you're able to describe the importance of genetics privacy and identify some existing policies on the topic. Next slide, please. So this webinar will be in 4 parts. We'll start with discussing the basics of genetics privacy, and we'll describe what information we have about genetics privacy in the NCC Genetics Policy Hub. And this will be followed by a discussion by Ms. Karen Vole and Dr. Angela Shepard, who provide their perspective on genetics privacy through a conversation. And we'll end today with a question and answer session. Next slide. So to begin, and to provide some broader context for this webinar and overall what genetics privacy is, on this slide is a definition of genetics privacy. So it's defined as the protection of genetic information from unauthorized disclosure to third parties. So there's a few different terms to unpack in this definition. What is genetic information? So genetic information itself can include DNA test results, biochemical tests, newborn screening results. It can also include a diagnosis made from a healthcare provider or history obtained from family. And third parties can include family members, employers, insurers, law enforcement, the government itself. And unauthorized disclosure can mean an individual did not provide informed consent for their genetic information to be disclosed to one of these third parties. Next slide, please. So thinking more about that definition, I think the question is, how does genetic information and unauthorized disclosure of that information intersect with policy? Why is it a policy concern? So genetic information is inherently sensitive because disclosure may convey information that an individual may not want to share for a variety of reasons. And one of those reasons may be concerns about discrimination. So discrimination related to genetics information is a common discussion, and it's a focus within the landscape of genetics policy. So in this webinar, we'll be highlighting more related to how policy at the state and the federal level provides protections against such disclosure and discrimination. We'll also hold an interview with our co-presenters from NERGN who have contemplated genetics privacy in their own lives. Next slide, please. So we'll be diving into those topics more. But first, I just wanted to take a step back to give more information and an overview about the National Coordinating Center for the Regional Genetics Networks and our policy hub and the work we do around providing information about genetics policy. Next slide, please. So for those who might not be familiar with NCC, as we call ourselves, we are the National Coordinating Center for the Regional Genetics Networks, and we are a program that is federally funded by the Health Resources and Services Administration, HRSA. So NCC, along with the 7 regional genetics networks, which includes the New England Regional Genetics Network, as well as the National Genetics Education and Family Support Center, all work together to achieve the mission of improving access to genetic services for underserved populations. Next slide. So NCC works to achieve our mission in a variety of ways. So some of those are highlighted on this slide, which range from genetics and genomics education activities to improving access to services via telemedicine, or we call it telegenetics. And family engagement partnership is also really an integral part of our system in engaging those who have genetic conditions or who are at risk for genetic conditions to understand what their needs are. And then finally, NCC also has a focus on policy, and that is where our genetics policy work comes into play. Next slide. So this work really began for NCC a number of years ago with the passage of the Affordable Care Act. Once the Affordable Care Act was passed into law, HRSA, our funders, came to NCC and the regional system to begin to develop specific resources around policy to help support the delivery of genetic services. And that can mean things like genetic testing, genetic counseling, treatment, and follow-up services. So overall, what our system really focuses on is getting access to these services. And we're really looking at that delivery between patient and provider. And so in 2015, NCC held a meeting with a group of partners to identify what the policy issues were and what resources are needed to better understand the policy landscape related to the delivery of genetic services. I will note that because we are federally funded, NCC is not positioned to advocate for any certain policies. We don't have a stance and we don't lean in one direction or another for any certain policy. Instead, NCC is really looking at this work through the lens of what policy resources are needed for providers, for public health professionals, families, to understand what's happening in genetics and how that affects the delivery of care. So in 2017, HRSA specified 2 objectives for NCC to accomplish related to our policy work. Those are to look at monitoring, analyzing, and tracking of national policy issues. And we're also tasked with disseminating information on the practices, policies, and the resources related to the genetic service system. Next slide, please. So we have been doing this work for a number of years, and we've developed multiple resources over that time. And NCC has recently compiled these all into a new policy website that we were very fortunate to launch last year, called the Genetics Policy Hub website. So this is a fully searchable website where you can search for topics and information related to genetics policy, like genetics privacy, and find everything we have related to that topic. And there's information not just about genetics privacy, but a wide scope of genetic policy areas. So there's a lot of great tools and resources on this website, which I'll go into more detail as we go along in this presentation. But briefly, we have policy area pages that summarize different topics and policy concerns that impact the delivery of genetic services. You can find all the proposed genetics legislation and regulation that we track. And the website also has a Medicaid database, which is updated annually. And there we look at all the publicly available written Medicaid policies related to genetic service delivery. And the website also has general resources, events, information, things like this Genetics Policy Hub webinar series, also other webinars and educational events we hold related to policy. Next slide. So as I mentioned, this is an example of one of the tools on the Genetics Policy Hub website. So this is one of the policy area pages. This one's for genetic privacy. So each page for each policy area is structured similarly. So it includes short briefs that describe why a certain topic is a policy concern for the genetics community. It lists the current proposed legislation and regulation related to that topic. And we also share policy statements from organizations that present that organization's stance on that topic, like genetic privacy. Next slide, please. So one thing you'll find on the policy area page, specifically for genetic privacy, is information about HIPAA and GINA, which are 2 of the main statutes that protect genetics privacy. And these really inform some of the policy currently being introduced at the state level that I'll be discussing a little later on. So the Health Insurance Portability and Accountability Act, HIPAA, became law in 1996. So this law regulates the disclosure of medical information in healthcare settings, and it regulates how and when health providers can disclose your medical information, including genetic information. So for example, if you have genetic testing and someone else other than you calls to learn the results, HIPAA prevents this disclosure without your authorization. And the Genetic Information Non-Discrimination Act, which is often referred to as GINA, was enacted in 2008. And it's intended to prevent discrimination based on genetic information by both health insurers and employers. So before GINA became law, it was legal for a health insurance company to charge a person more for health insurance, to raise their premiums, or to deny them health insurance overall, and not provide coverage based on their genetic information. So one thing that's important to know about both of these pieces of legislation is that HIPAA and GINA do not apply in all situations. So neither apply to life, disability, or long-term care insurance companies. It's legal in some states for a life insurance company or a disability insurer to ask if an applicant has had genetic testing, and then it can make coverage decisions based on that answer. Or it's legal in some states to require testing prior to providing coverage. Also note the legislation and regulation may not specifically or directly mention genetics privacy. Instead, some policies includes more general protections, and those still might indirectly lend themselves to genetics privacy and preventing the disclosure of genetic information. And there's also a need for protections related to genetics privacy when it comes to research on human genetics and medical research. And so regulations have also been written to protect research participants' genetic information as well. So that's really just a broad overview of some of the basics of genetics privacy. But if you're interested in learning more about these two pieces of legislation, I really encourage you to visit that policy area page about genetics privacy. It has great explanations of these bills. We also have other great resources that we link out to, like the National Human Genome Research Institute, NHGRI. It's a really great fact sheet about GINA and also some information about the regulations related to research. And the Department of Health and Human Services website also has more information about HIPAA. But we're always looking for more information to link out to. We're always so appreciative of ways we can connect with other organizations and the work they do, really help provide education and disseminate information about genetics policy and topics like genetics privacy. Next slide. So also on the policy area of the page, on the Genetics Policy Hub website, is different policy statements. So NCC is tasked with disseminating these statements from organizations that work within the genetics community. So like national genetics organizations, advocacy organizations, and the like that have published positions on genetics privacy. And so we've collated all of those policy statements together. So the three listed on this slide are from the American College of Medical Genetics and Genomics, the National Society of Genetic Counselors, and the last one is from the American Society of Human Genetics. And these are all policy positions that were published within the last 5 years or so to highlight some of the more current policy concerns and interests from genetic organizations about genetic privacy. So you can really see there's a focus on the exchange of de-identified genomic data and about protecting privacy, on direct-to-consumer home genetic testing, and also related to privacy protections for genetics and genomics research. Next slide. So another tool within the Genetics Policy Hub that we have is our tracking of proposed and enacted legislation and regulation at both the state and the federal level. So we use a system called Physical Note. Every day we look to see what policies and what bills are being introduced based on specific search terms related to genetics. So genetics privacy and related terms like direct-to-consumer testing, healthcare coverage, or just a couple of the topics that we track. So currently there are 28 proposed and enacted legislation related to genetics privacy. 26 are proposed and 2 are just enacted just this month. That's across all of the US. So those 2 bills that were recently enacted were in Tennessee, and the rest currently on this list are proposed and in review. And I'll discuss a few of those bills in more detail on the next few slides. So of note, these are all bills that have been introduced since the beginning of the year when the new session of Congress began. So you can see we're really seeing a trend in an increased interest and more discussion from state legislators about genetics privacy. And really, they're seeking to address genetics privacy concerns through policy at the state level. Say of the genetics policy legislation that we track, has one of the larger number of bills that have been introduced since the start of the year. And on the Genetics Policy Hub website, we do have a clickable map of the United States. So you can see specifically what proposed legislation or regulation related to genetics privacy currently exists, as well as legislation related to other genetics topics. And you can sort by a specific state or by a specific policy topic area. So that's a really great resource to learn more about current genetics policy. Next slide, please. So NCC also has a Twitter account that publishes information about the state and federal legislation we track. So this is an example of what the graphics on the tweets look like. We provide the status of the bill, whether it's proposed or enacted, the bill number, the title, and relevant information within the text of the bill. So this graphic is about one of the bills that was recently enacted in Tennessee this month, called an act relative to genetic information. So this legislation provides that a life insurance provider cannot cancel coverage based on individual genetic information or genetic information of a family member. And it prohibits life insurance providers from requiring genetic testing prior to providing coverage. And it also sets provisions for access to medical information, including genetic data. So you can see this legislation is really addressing some of those potential limitations of HIPAA and GINA that were noted earlier, that the fact that they don't apply to life or disability or long-term care insurance companies. And you can see some of the other states are beginning to address this gap in the federal legislation as well. Like Florida, South Carolina, and New Jersey have also introduced bills with similar elements as this one enacted in Tennessee. Next slide, please. So these are a few examples of all proposed state legislation introduced this year related to genetics privacy that has some different provisions than the bill I mentioned in the last slide. So in Pennsylvania, House Bill 812, this is a bill focused on the disclosure of information collected by genetic material testing entities. So this allows for residents of the state to have the right to the use and sale of their genetic material. And it requires any for-profit genetic testing company to acquire permission from an individual before they can share that data with any third party. And it also requires that individuals are adequately compensated for their use of their DNA. In Hawaii, Senate Bill 1471. So this proposed bill focuses on the disclosure of individually identifiable health information of a newborn that was obtained through newborn screening. And it prohibits the disclosure of this information to anyone other than a newborn's parents or guardians. And then in New Jersey, this bill is introduced by the Assembly. It's also related to newborn screening. So this would limit the purposes for which genetic testing may be conducted on DNA samples for newborn screening, in that newborn screening samples would only be used for the purpose of detecting disorders or conditions that are screened for in the state. So while current law in New Jersey generally requires the informed consent of a person or a person's representative in order to obtain a person's genetic information, this currently doesn't apply to newborn screening. So you can see at the state level, based on the bill enacted in Tennessee and these examples of proposed legislation, it's really a variety of policy and policy concerns related to genetics privacy that state legislators are seeking to address. So about life insurance coverage, about disclosure of information by third parties related to these areas of newborn screening. So the bill in Tennessee that I talked about and these three bills on this slide are just a few of the bills that are currently in session related to genetics privacy. So if you're interested in learning more, again, you can go on the Genetics Policy Hub website and view all the proposed and enacted legislation we track about genetics privacy. And you can view those policies by a certain state by a certain topic area. Next slide. Thank you. So lastly, along with all this information presented today, we also created a policy brief to give you an overview of what was discussed in this webinar today. So this is really a snapshot of genetics privacy as a topic, like all policy and like the field of genetics overall is really constantly evolving. So I would encourage you to go into the Genetics Policy Hub website and download this overview if you're interested and want to learn more. And to explore those other tools and resources that were shared today, like the policy area pages and the legislation that's being tracked. Also, earlier I briefly mentioned our Medicaid database, which uses publicly available coverage policies to provide information about what genetic services are covered under Medicaid. So currently, Medicaid programs do not have specific information about genetics privacy. They don't provide that information publicly. But this is something we will include in the database if this information becomes available in the future. So with that, I will turn it over to Dr. Shepard and Ms. Karen Bull for a conversation on genetics privacy.
Hello. Thank you so much. That was really interesting. I love what the NCC does in terms of policy. And so it's just great to hear the overview. I'm Karen Voley, and Dr. Shepard is my colleague. Do you want to introduce yourself at all?
I'm Dr. Shepard. You can call me Angela. I just joined Nergan, let's see, 2 months ago. So I'm still fresh and learning, but excited to be here.
I'm still fresh and learning too, and I've been here for 15 years. It's amazing. Well, I'm super happy to have a chance to kind of share a little bit about my experience. So Angela and I kind of set it up so that she would ask me questions that we thought that might be kind of a nice way to go.
Yeah, when Karen initially talked with me about this, I was a little nervous to participate in the policy session because I thought other people have so much more expertise in this area of policy. But in our discussion with Karen, I thought that there are really some interesting perspectives that we could bring out in this sort of clinician-patient interaction. So Karen, are we ready to just go ahead and jump in?
I think we are. Thank you.
All right. So I am no longer practicing medicine, but have in the past. And so I will act a little bit like a physician and also Karen's peer at the same time here. So Karen, would you mind sharing your family's medical history? There's a genetic diagnosis, I believe.
That's right. That's right. My mom had Huntington's disease, which I'll call HD. That's what it's referred to. Mm-hmm. And she had Huntington's it's a late onset disease, so it's going to impact. It often impacts people in their middle age, or there's a wide range, but it's middle age onset kind of condition. My mom was 68 when she was diagnosed. I am at risk for it. I have a 50% chance of inheriting this condition. And I think if the way that people have tried to describe it is that it's like having ALS and Parkinson's and Alzheimer's all at the same time. So it's not a small thing.
Mm-hmm. Yeah, it is a potentially devastating neurological condition. And you have chosen not to be tested for it?
Yeah, that's right. That's right. Mm-hmm. It's quite a complex decision and definitely not one. It has to be a personal decision. Mm-hmm. There's just no one right answer to that test, that question. Mm-hmm. But part of my reason might be kind of pertain to what we're talking about. Mm-hmm. Yeah. And actually I wanted to share an experience that my sister had. She was a young parent, so maybe 30 or so years ago, and wanted to get life insurance. Right. Which that's very logical. That's what we'd all would want to do to take care of our family. Mm-hmm. But her life insurance vendor denied her because she had been turned down. They denied her because she had put in her medical record that we had a family history of Huntington's. Mm-hmm. And at that point in time, we thought we had actually gone past the window where my mom could still get it because she was quite old, right. Relative. So it really was surprising that this would be the situation. But my sister went ahead and had the test, which, thank goodness, she was negative. It's one of the best things in my world, frankly. But when that happened, we all kind of decided as a family that we're not going to share our medical history. It's, what my parents taught me, and it's what I taught my children. So it's never gone into the medical record for me still, until maybe 5 years ago. The past 5 years, I started deciding, hey, I really want to have integrated health care. And so I felt comfortable enough to take that step then.
Yeah. And that's one of the things that, as we talked a little bit about this in preparation for this session, as a doctor, how much it affected me to think about my patients not feeling safe, being able to share what's going on with them, for fear that something that I would say or write in a record could harm them. And I can only imagine how hard that must have been for your family members to go in to seek medical care, but know that they had to keep part of this huge part of their life secret. Can you talk to me about, trying to seek care, but having that kind of conflict?
Yeah, that was always so difficult. And probably, everybody in my family is different too. I have 2 children. One has gone on to be very stringent about not sharing. One is more, yeah, I'll share. So we're not all the same, even in my family.
Right.
But that idea of, it's just such a heavy, profound weight of being afraid to tell people. And actually, with Huntington's in particular, there's just this incredible stigma. So people just didn't and don't really talk about it. And in fact, my grandfather had it, and I just remember growing up, he would always be in the back room, and we wouldn't really get to see much of him at that point in time. His father before him had Huntington's and died in an institution, which is kind of typical. Then when my mom was diagnosed, I wrote myself a letter to kind of process the whole thing. And it was so scary and overwhelming, and I was so terrified that someone would find the letter that I mailed it across the country to my sister. And she put it in her safety deposit box for at least like 10 years or more. That's how on fire it was to just even admit.
Right.
But a big concern too, and I really want to think about young families now, that concern about getting insurance and not knowing who to talk to, or if you can even talk to anyone. It's very hard to get information because you have to disclose a little bit in order to get it. And I had a lot of anxiety trying to negotiate that way back when. So I guess my hope is that people understand, the people making the policies, I want them to understand how it is, and how long reaching those fingers are, so I decided 30 years ago something, and it's still going out to the future with my own kids. So I guess what I'd like is for people to be able to come out into the light. And
what's happened over the years that's made you feel comfortable coming forward now? Was with Gina, did that help in this decision making, or?
Gina helped a little bit, but I always had in the back of my mind, what if it changes and my information's out there? You can't take it back. So it only helped to a degree. But honestly, what really helped, I was thinking about this.
Mhm.
When I first started working here, I went to a conference put on by the Genetic Alliance,
Mhm.
and they talked about openness. It was the first time it occurred to me.
Mm.
I just was blown away by that. People were going by their first names and sharing their favorite hobbies, and it really was that conference. And then gradually, I became more and more of what I thought would be kind of the best advocate that I could be, which is a quiet behind the scenes one who
Mhm.
does not like to do Zoom webinars,
Mm.
but yet it's important enough um,
Mhm.
to me to be here.
Mhm.
And it's been right for me. But again, my children have to make their own call
Mhm.
kind of about that.
Yeah, I think one of the things I was really pleased about with this presentation is making some of the distinctions about what federal policies cover and what state policies cover. And I was wondering whether or not for you, did issues like this ever come up if you were looking at what state you wanted to settle in? Because federal laws can, like, they will cover some things, but as they talked about, that we might need to have a state law that would protect your right to get life insurance, or just what are some of the, like, the day-to-day decisions that could be impacted by some of these policies?
Well, one thing, I didn't really make a decision about a state or not,
Mhm.
but it did decide what kind of organization I wanted to work in.
Mhm.
Because before I was working with a small nonprofit that didn't have a big insurance structure.
Mhm.
So I wanted to work at a big organization like a
Mhm.
university. Uh,
Mhm.
so it's odd how that does, the ability to get insurance. It does play into it. It's a huge.
Mhm.
And happily, UNH offered long-term care insurance policies here several years ago. So I have that.
Wonderful. Yeah.
And if I didn't have that, I would never make this presentation, actually.
Mm. And I think that that's something that's important for all of us to hear and understand. I feel like I would have lost out tremendously as a person, as a medical professional, if I wasn't able to hear your story. And so patients' family members are keeping a hold of information that's valuable for their own care, but also for us to be able to help others to be able to inform policy decision, because they need to protect themselves first. So I'm really happy. And if there's any way that you could suggest how we could be utilizing this information to be able to be making it safe for patients, to be able to be getting information out there.
Interesting. I'm glad to hear it. I always think about the doctor perspective too. I think it's just going to have to be growing bit by bit about that. Helping people find other people going through the same thing is always just tremendous. We do that here through NERGAN, but we also, I'm like a member of a support group with the Huntington's Association. Hearing other people's stories really does help. But I'll have to give your other questions some more thought too.
Oh, that's all right. I didn't mean to put you on the spot.
No, it's a good one. It really is.
Um, what kind of decision-making process um, do you think, like, for yourself, for your kids, in what identifying what is a trusted individual, or like what information like puts you at risk? How do we kind of know what things need to be evaluated by policies? Like I thought with HIPAA, I thought my patients would feel comfortable telling me things because it would be within that setting, it would be safe, that they were guaranteed some protection. And it didn't occur to me what the patients were experiencing. So it seems like there's a whole other layer to this kind of policy that I, as a provider, never thought about. How do you know what's safe for your patients?
I'll have to think about that too. I'm not sure I have suggestions for it other than you know, gene is important, but we need to do more than
Mhm.
just have that protection. I wish it could not be political, but of course it must be
Yeah.
political.
Mhm. Yeah.
Do you have
Uh,
ideas?
This was such revelatory information. Our conversation we had was really, it's not often that I'm taken aback. And I have to say I was, from our conversation about like how you had to keep a secret and your family told you and you advised your kids to keep these things secret from your doctor when it had such huge potential health implications. Um, so I was like hurt, shocked, and just really disappointed. I feel like, that potentially as providers, we were letting our patients down by not being aware of the policy implications of asking a simple question.
Well, that does, I mean, when talk comes to genetic testing, we have to talk about the cost of it and
Mhm.
but also the insurance implications.
Mhm.
And I know there are ways to see people without having it go in your medical record.
Mhm.
There are some workarounds like that, and that I think it's just really good to put yourself in someone else's shoes, um,
Mhm.
to imagine that and bring it up or be open
Mhm.
to those talks with your patients.
Yeah, it's really, like I said, eye-opening for me. Just checking my notes here because I jotted down a few things. You'd mentioned that about your sister being denied life insurance, and I wanted to know if you had any other examples of discrimination or other stories like that that you might want to share from your family.
I'm really not, oh, there aren't anymore from my family. It's more about the threat of just the notion of losing your valuable insurance.
Mhm.
Um, that was it. I don't think anybody else, even my mother, I don't think she experienced genetic discrimination. She was retired before she was actually diagnosed.
Mhm.
So that kind of thing.
Mhm. And there's other conversations we've had about things like research and genetic testing. And that, in my perspective, um, personally, and as a medical practitioner, is that I always want to have more information. I have a kind of a default, a bias towards testing more, learning more. And we've sometimes are a little bit at odds in that, and because you are much more caution me to think about the implications and think about privacy as the number one concern. Because for me, it's always more knowledge, and for you, it's always privacy first. Do you think that those kind of internal biases, are these things that might be kind of a barrier for us in determining policies as we go forward?
I feel like it's going to be on the plus side that we have
Mhm.
those different views.
Mhm.
Totally. Not, I don't think it's going to be a barrier at all.
Mhm.
I think people get in the room and that's what the work is to
Mhm.
talk through that. But no, and overall, I feel like when policies get made, there are so many levels that must go into it.
Mhm. Yeah. So I am really proud of you, Karen, for talking about this, and I'm glad that you kind of nudged me to get over my hesitance to present amongst the experts here. But do you mind if we open it up to see if other
Yeah,
folks have questions and things?
sure.
Okay,
Yeah, I think that's great.
right.
Thank you, Angie.
So there's some there in the chat, but I think I'll let Molly, if you want to kind of take over as the referee. And I think, Karen, do you mind if people want to
No, I
unmute
love that.
themselves to participate? Okay.
Yeah.
Absolutely. Thank you both so much for sharing, and for this really great discussion. I think this is such an important conversation that really elucidates the impact and the importance of genetics privacy and really the policy surrounding genetics privacy. So there are just currently two questions in the chat, questions in the chat. So the first is, it's especially troubling to me that you can't have conversations off the record with a healthcare professional to get information? How could this be addressed? And have any healthcare associations considered policies about having conversations that don't get documented in the record?
Ooh, that's a good one.
I'm not sure what the official policy is on this, but Karen and I had talked about this a little bit, and that I would regularly have off-record conversations with my patients, but I tend to be a bit rogue in how I interact with my patients. But I think that is a valid way to try to gain some trusted rapport. I guess the concern would be that we're always taught like that, if it's not documented, it didn't happen. So if there's something that you feel for liability purposes, or that you would feel that you would need to remember in coming back to interact with this patient again, like if you had a very large patient panel, I guess your patient, you'd have to kind of warn them ahead of time that they might not remember the conversation if you interacted with them again, and to not be hurt by that, but that it was left out of the documentation for their comfort level. So I think it's possible. I don't know that there's a healthcare organization, professional organization that has addressed this, but I could look into it for you.
Yeah, I think that's really interesting idea. And in fact, I think I did actually have some of those informal conversations with providers that I'd had for years and years. And it seemed to work. It was very helpful, I think, to both.
Great. There's another comment in the chat. If new federal state policies are enacted that provide protection from discrimination based on your family history by life insurance policies, long-term care and disability insurances, do you think you would have felt comfortable to share this information sooner with your providers? Are there other specific protections you are looking for?
In my case, yes, I do, because long-term care was my big concern. And it's one of those things that's kind of fluky when you're just kind of a young adult or young parent. It's very odd to try to get educated on that, but that really would have made a big difference to me. My sister's experience with life insurance, I think it was pretty early on with the genetic testing for Huntington's. And so, I mean, that was just so blatantly wrong. I bet it didn't go on very long. I'm going to say, I hope.
Absolutely, thank you. So we don't have any other questions in the chat, so I just wanted to give anyone a chance to ask any other questions. But if not, it's 2:50. So we have one more comment. Karen, have you heard any stories in your exposure with others, like through support groups? Are there other genetic conditions that could be similar in people wanting to hide?
That's interesting. I don't think we're talking about your newborn screening kinds of categories, but I think, you know, the late onset Huntington's is pretty unique. But there are probably, my thing is gonna stop. My computer.
Oh, so
Yeah, I haven't heard of anything that's specifically like this. I think Huntington's is kind of unique. On the other hand, they're all unique. And so just because I don't know doesn't mean it's not out there.
yeah, I think, Karen, you're right in that Huntington's is unique, particularly because of that very delayed onset. But I think anything that doesn't present fairly early in childhood could potentially have some of the secrecy around it. But I could see this also being true perhaps for carriers of particularly devastating disease, being concerned about there being some stigma related to that. I have not had conversations specifically with people about this, but I could envision that being true.
Oh, very good question.
Mm.
Thanks, Allison.
Great. Thank you to everyone that's made a comment or asked a question. Thank you to our co-presenters for sharing as well. So we don't have any other questions. If anyone comes up with a question after this webinar is over, you can absolutely contact NCC. We have one more comment. Thank you for sharing your story and for all the advocacy work you do. Sure, and yeah, there's a question about sharing the policy website. Was there any portion of the website that you were interested in learning more about?
Yeah, sorry, I'll unmute. I was trying to type quickly. Like, for example, I was trying to, while you were talking, I was trying to find the Tennessee law that was just enacted. I do advocacy work in Illinois, and we've actually put a policy or have tried to draft some legislation about additional protections in genetics privacy recently that was unfortunately not successful. So one of the recommendations we've always received is to look at other states that have successfully enacted that legislation, which is really powerful for our legislators here. So I was trying to look on the map and click through to see if I could find that Tennessee legislation to share with our group.
Sure. Yeah, absolutely. If you're not able to find it on the map, you can also use the search bar to type in the title of the bill or the bill number, but I can also share the bill number and the name of the bill.
I think Molly's frozen. Can anybody else hear? Yeah.
Yes, I think Molly's frozen. So hi, I'm Megan Lyons. I'm the co-project director of the National Coordinating Center for the Regional Genetics Networks, who does the policy areas, or sorry, does the Genetics Policy Hub. We are happy to send you that bill number, and we can absolutely provide you a tutorial if you would like, either now, later, or we can send it to you via Zoom link so you can see how to get to it. Because I don't want to we're the recording, and I don't want us to have any trouble for you. But we're happy to do that. So please reach out to us, and we're happy to help you go through the Genetics Policy Hub.
Okay, thank you so much. What would be the best way to reach out to you all? I can put my email.
We'll email you. We have your email address.
Sounds good. Thank you so much.
Yeah, absolutely. Are there any other questions or concerns?
Thank you, everybody, for supporting my wonderful Karen.
Yes, thank you so much to both of you. It was excellent. And again, we will, if anyone has any questions about the hub generally or how to access specific bills, we're always happy to do that online or get on a call and walk you through it. So please just let us know. So thank you so much. And we hope to see you on a future Genetics Policy Hub webinar. Thank you all.
Have a good weekend.